a lot of patients don't think about maxing out their insurance benefits because when it comes to health insurance, there's really no maximum typically. You have a deductible, but at the end of the day, if you need a lot of medical treatment done, they're not going to suddenly cut off the benefits. But when it comes to dental, they always will cut it off at the time they say they're going to cut it off. So if you're allowed $1,000, by the time they pay out the $1,000, you won't have any more insurance benefits to use. Sometimes even the cleanings won't be covered after that maximum is met. We do hope that the patients can understand that very well before we start any kind of treatment. The most important thing that patients should know is when their active dates are for their insurance plans. Some people do end in October, some people end in November and restart then. Some people restart in May. But for the most part, we can expect January 1. For patients that aren't used to getting a lot of dental work done, in the unfortunate circumstance that you need, say, like a root canal and a crown done in the same year, that alone might max out your insurance benefits. So, not to say that we expect bad things to happen at all, but if we know we need some treatment done, it's always smart to consider going in the end of this insurance year, just in case we do need to use all of the following year's benefits. Okay, so there's really two different types of health savings accounts that are offered by employers. We have what's called an HSA and an FSA. With an FSA, it's something that's put away pre-taxed that we're allowed to use for health-related things. And it's a great benefit that a lot of employers will offer, and you also can opt into having it. HSAs are very similar. I would say the difference there is HSAs do allow some of the money to roll over into the following year, whereas with flex spending accounts, most of the time we have to be billed in the actual year for that before those benefits do go away. So we don't exactly have to finish the treatment by the time by the date allotted, but we do need to be billing the patient prior to that date. So we have until actual tax day for the flexible spending account and an HSA to actually use to actually report the benefits being used, but we have to at least bill them within this calendar year for it to be working for a flexible spending account. So before you come in, it would be good to at least know the terms of your plan. We can look up some of that information too for you if you're curious, but it's also easy for you to call member services and just kind of get an understanding of when your benefits change over into the new year.